And I want to get a little bit more into why you're here, because we've talked about the medicine side of things and the emotional support and the family support and the great support from Stanford Pediatric Rheumatology. But I guess you need some legislative support. What's going on there with some legislation that's pending?
So there's never really been an actual bill or any legislature to address the arthritis issue. The CDC has come out with new studies that saying that 46 million Americans currently suffer from 100 different forms of arthritis. In California alone, we have 5.5 million people. And to the CDC, it's a big concern. And so now the Arthritis Foundation, with their advocacy group, has asked the Senate and the Congress to address it. In September, the H.R. 1210, which is the Arthritis Prevention, Control, and Cure Act, actually passed in the House, but now we're waiting for it on the Senate. And on the Senate floor, our local Senator Barbara Boxer actually put the bill onto the Senate floor, and it's currently in a committee. And so we have a very short window of time to try to get this out of the Senate committee and then onto the Senate floor. And so that's why I've asked you and all of the listeners of the show is to call your senator, call Barbara Boxer, call Dianne Feinstein, let them know that you have a daughter, you have a friend, you've got a sister, you've got somebody that you know that has arthritis, and we need help.
What would the bill do?
Some of the things that it's going to address is it's going to strengthen not only the public health initiatives, allowing more people to be diagnosed early and to minimize their pain, but also it's being adding more rheumatologists, adding more doctors, adding more programs, adding more research grants. Being able to find, maybe better medications or a cure. So there is a monetary component, but there's also being able to track. I mean, currently we only know of 300,000 children,
right?
But without any real data to support what we're trying to say, this bill would allow us and allow the CDC to actually track children with arthritis.
I'm thinking of a similar story. My son was 12, but he was diagnosed with diabetes. But we didn't know, and nobody knew. And he reached his nadir on Super Bowl Sunday, and we took him to emergency. And luckily, a young doctor said, let's check his blood sugar. And before he said that, he said, we might lose him.
Oh, my.
It was one of those moments.
Yeah.
So I know what you mean, about having someone be aware and having perhaps more focus on a particular condition. So how do you feel about that? Is it important to pay more attention?
Absolutely. I think it is very important. I think this is a big issue because currently there are only about 250 pediatric rheumatologists in the United States. And Maya and I were counting just before, there are about 9 states that don't have a single pediatric rheumatologist. And there are probably another 9 that have only one in the entire state. Luckily, California, we have quite a few. But I think this is an issue, and that's why it's probably undercounted the amount of kids that have arthritis because there's not anyone to evaluate it. Just like you had said about having people aware.
Yeah, and lucky Maya, she lives in California.
Exactly.
Because if she were in, say, Kentucky.
Well, it would be Nevada, Montana.
Well, you pay
West
your
Virginia.
doctors with chickens in Nevada, I hear. That's what I heard. I'm not sure about that. But, yeah, there's a lot of places like that. So fortunate for Maya, she's here, and we like to help the fortunes of a lot of children around the country. Now, this window you're talking about, we're talking about this Congress? We're hoping to get it through this Congress?
111th Congress, which just went into session on Monday. They will break before Thanksgiving for that week and then come back for the following first week of December. I've reached out to the county executive. I've reached out to our county board of supervisors. I've reached out to the mayor. I've reached out to my council member. I've reached out to as many people that I possibly can to just pick up a phone and call them and let them know. Even to the degree that in our own Santa Clara County, the public health department doesn't list arthritis as a prevalent disease. Whereas, yes, diabetes, it's an important issue. And actually, the arthritis could be a symptom of diabetes, but yet you wouldn't be able to get the same care for your arthritis as you would for your diabetes. And it's an important issue. And at least at the county level, I'd like to see for other families, like you had mentioned, there are families that can't afford health care. Heck, even though we live in California, in this great place where we've got Stanford, USF, and great doctors, there are other families out there that can barely afford to go to the doctor to find out. And so just getting it there in the public's eye and awareness, put it on the county website, get people out to our walks and our events.
Let us know about the walks as they come up, for sure, but walk us through it right now as far as what you would like us to do so people can write this down, okay? The bill that we want people to call about and who we should call and what you think we should do.
So you just even contact your local senators. Right now it sits in the Senate floor, and that Senate bill number is 984. In the House of Representatives, the bill number was H.R. 1210. It's its counterpart. And basically call every senator that you have that's in your district or that represents you to ask them to pass this bill, to get it out of the committee, get it to the floor, have Barack Obama sign it into law, and let's help start the process of curing some people.
How will that improve things for you, Dr. Lee? You're at a pretty good clinic, aren't you?
Yeah, I think it would. I have patients that come and drive 9 hours to see us one way because there's not anyone anywhere close to them. And so I think getting more pediatric rheumatologists trained is going to make a huge difference for the patients. It's a ordeal for them to drive 9 hours, see me for 30 minutes, and then drive 9 hours back.
Yeah, absolutely. And you could be improving their lives.
Absolutely.
All right, Maya, thanks for coming in to talk to us, Dr. Lee, RJ. Maya, I hope you feel really good for the rest of the day and the rest of the week and the rest of the year. Take care of your stuffy and take care of yourself.
Would you like to join me in the arthritis walk?
The arthritis walk? When is that? Is that in March or April?
April 30th.
April 30th? I'll be there holding your hand.
Okay.
Maya and I will be there with bells on for the arthritis walk, and we do hope you'll join us. I'll be giving you details as the months roll by. That's our South Bay Sunday for another week. I am Sam Van Zandt. Thanks a lot for listening. Have a great Thanksgiving this week. We'll see you next week here on South Bay Sunday.